This is Reporter's File on WOKQ.
Welcome to Reporter's File. I'm Sam Adams, and with me is Janet Atkins, Executive Director of Goodwin Community Health, and Lara Willard, who's the Director of Marketing and Public Relations there. Welcome, both of you, to Reporter's File.
Thank you.
Toss-up question for each of you. Tell us about Goodwin Community Healthcare and some of the things you provide.
Sure, I'd love to. Goodwin Community Health has been in the community for 43 years and was started by a woman named Avis Goodwin. She was a social worker who worked at Wentworth Douglas Hospital and recognized that women were coming into the emergency department without any prenatal care. And in those days, if you were unwed, you were not able to get onto Medicaid. So she got a group of physicians that worked at Garrison Women's Health, and they volunteered their time and held a clinic to provide free care for these women. So in 1969, when we started, we were a department of Wentworth Douglas Hospital. In 1971, we became our own 501c3 and really have grown in leaps and bounds since then. We expanded into primary care in the 1990s, and then into dental in 2004, and then into behavioral health in 2008. So right now, we provide a completely integrated model of care. That means not only do the providers work together as a team, but they're also able to communicate through our electronic health record, which we've had for about 15 years. In addition to that, we have other support services such as Women, Infant, Children's. We have the Commodity Foods program. We have social workers. We have chronic disease managers. You name it. It's really meant to be one-stop shopping for people. Mm-hmm. And I think that it works really well for the people that we serve. We do serve about 8,000 individuals. And our mission is to provide quality integrated care to all in our community, which is based on what they can pay us. So we do provide sliding fees for our services depending on household income.
Mm-hmm. 8,000 people that you serve at this time. Where are they from?
They're mostly from Stratford County. We do see about 5% from southern Maine area and maybe another 3% from southern Carroll County. But the majority of our patients come from Rochester, Dover, and Somersworth.
Mm-hmm. And we are a community health center, and we're a federally qualified community health center. And we are the community health center that serves Stratford County. And what that means is we're part of a larger network of community health centers. There, I believe, are 9 across the state?
No, 14.
Oh, excuse me, 14 across the state, and there are hundreds of them around the country. And community health centers all share a similar mission in that they offer people care regardless of their ability to pay. And we do that on a sliding scale fee. So you can pay according to what you make. That being said, we also provide high quality care in the mental health arena, in oral care, in primary care. And if you have the best insurance around, you can also come to our center and receive as good a care as you can find in any private practice as well.
Mm-hmm.
So Lara mentioned community health centers. The Federally Community Health Center program was started in 1969 by the Lyndon Johnson era, when the war on poverty was occurring. And so we've been nationally in existence for a long time. We do receive some federal funds. It's only about a sixth of our budget. We're about a $6.8 million organization, and we receive about $800,000 in federal funding. And what a federally qualified health center means that we do have a lot of rules and regulations. And one of the best ones that I like is that we're required to have 51% of our board members be consumers. So why I like that is because those board members can tell us about the customer service we're providing, about the quality we're providing, and they really know what their community needs. Or they have neighbors, and so they know where and what services we need to expand into.
Mm-hmm. I understand half of your board members are patients or former patients of your facility. How did that work out, and how does that help people?
Well, how it helps people is that immediately we know that this type of service that we're giving, because they can give us feedback. Every month we have a board meeting, and they can give us feedback about our providers, about the care, about the customer service, and they know what their neighbors need. So they help us decide on which programs to develop or expand into.
Having folks on the board that are experiencing what it's like to be a patient at our center gives direct feedback in real time. And I think we're a small enough organization that we can adapt and make changes right there in the boardroom based on the feedback that they're giving us of the experience that they had last week. Mm-hmm. So I think it helps us to adapt to what our needs are in real time.
Now, do you offer any programs or other avenues for preventative care?
Oh, that's a great topic.
We're all about preventative care, for sure.
We do. That's a great topic, though, for us, because we're doing something that we're really on the cutting edge in the state of New Hampshire. In partnership with the New Hampshire Charitable Foundation, we have embarked upon a screening and brief intervention for people that may have substance abuse. So it's a best practice model. We're the first ones doing it in the state. And what it means that if you come in for a physical or a yearly visit, that you'll be asked 3 to 5 questions. And if you answer one way or another, you may be asked more questions, and then discussion with the provider on, do you feel like you have a drinking problem or a substance abuse problem? And it has really proven throughout the United States that it does improve people getting care before they actually have the diseases. So we're really excited about that.
That not to be negative about it, but it sounds like you might kind of ambush some people with, they may not be expecting those questions, and they may get them. Has that been, have you found that to be the case or not the case?
Not at all.
Okay.
And it's really the patient's choice if they want to tell us the truth or not tell us the truth. But honestly, when you go to see your medical provider, it's often an uncomfortable question to ask. So the approach is, we do this for all of our patients. We're trying to be proactive on prevention. Alcoholism can be a chronic disease, just like diabetes. And so it really is a means of prevention, and it's universal. It's anybody over 18. So it's not that people are being singled out.
Mm-hmm. And you can help them right there. You can help them from that point on if they choose to enter, I would assume, a program that you have set up.
Well, it depends on what their needs are and what's available. I mean, if they work full time, we do have people on staff that are licensed drug and alcohol counselors, and so they can certainly see some of our providers right there at the health center. If they feel they need more support, we can refer them outside to Southeastern New Hampshire services.
Mm-hmm. In contrary to that point, too, some of the feedback that we've gotten is people are relieved that someone finally asked.
Really?
It seems odd nationally that this isn't already a part of primary care. It certainly plays into health and your health and the conditions that you're experiencing. And on that note, mental health plays into that as well. And that's another area that we're taking a leadership role in integrating mental health programming into primary care. So when you're now addressing your mental health state and your drug and alcohol usage into the primary care setting, you're really getting a much better picture of the whole person and how to treat the whole person and what's really going on and why you might be having some physical symptoms in areas. That shouldn't be left out of the conversation. And I think that ultimately, I think that you'll see programs like these rolled out nationally as there's a lot of healthcare changes coming our way, as we know. And I think that places like Goodwin Community Health are kind of pushing the envelope in trying to find better ways to treat people, ways to treat people more effectively and comprehensively. It can be so broken out. As far as, your dental provider knows what's going on in your mouth and has maybe prescribed you something for pain, and you're seeing someone else for mental health, and maybe they've prescribed you something, but your primary care physician doesn't have all the pieces connected. We are really trying to push the envelope to bring those things together in a way that more meaningfully addresses the health care of an overall individual. And when we talk about all of this under one roof and we talk about integrated healthcare, that's what we're doing and that's what we're talking about.
I know you probably want to ask us questions. We could just talk on about this all
go.
day.
Just go. I'll take a break and you can just talk here.
We'll just talk.
No, fine. Go. Whatever you'd like to.
No,
did you have something? Well, how old is that program that you were just talking about?
Brand new. We
brand
just
new?
had the training. It was Boston Medical Group.
Boston University is
came up and did the training for
us.
all the staff. And so it's been, a month they've implemented it. And I've actually been going into the charts. And so for another project, but I... just for research, better not put that on air, actually. But I see that these questions are being asked.
Okay.
So.
Okay. Now, you mentioned the mental health component of things, and that seems to be something that has been, I don't want to say left by the wayside, but certainly it sometimes doesn't get the proper attention that it could get. And from what I'm hearing here, you place that as important as anything else. Is that correct? Or?
Absolutely. We actually modeled our integration after Intermountain Healthcare in Utah. They have a fabulous program that they've been doing for about 12 years now and have actually demonstrated reduction in ER visits for depression. And so, again, lowering the cost of healthcare. We don't look at things in a vacuum. We look at the patient as the center, but also look at the partners so that they have a systematic approach across the continuum. Mm-hmm. But what happens is if a patient comes in and sees the primary care provider and the patient's saying, I'm a little depressed, and they'll get some forms to fill out. And depending on how they score, we'll sort of ask them, well, do we feel like you need a case manager to help you through this? Or do you need to see one of our therapists? Or do you need to see a psychiatric nurse practitioner? Or do you need to be referred out to a psychiatrist? Okay. And so then it's the provider, the behavioral health specialist, and the patient that sort of work together as a team, and they really have a care plan that works for the patient as a whole.
I don't think any discussion about health in this state or in this country can be complete without mentioning the rapidly approaching Affordable Care Act that's going to be coming toward all of us very soon. We talked a little bit about it before we went on the air, and I would just like to know, is Goodwin Community Health, are they prepared for this law? Is it a good law? What are your feelings on it?
Well, I think we're prepared for what it is today.
Okay.
And we'll hope to be prepared for what it is tomorrow, because I'm thinking it's going to be different. I mean, a lot of it depends, or some of it depends on whether or not the state votes to expand Medicaid. Because if they don't, then people that are eligible for the exchange can choose not to be on the exchange because it becomes a hardship. And so there's just a lot of variables out there. But we are absolutely ready to enroll people. We received a grant from the federal government, and we can actually enroll and assist people in one of the healthcare exchange and for Medicaid managed care applications. Because as you know, it's not just the exchange that we're going through. It's also we're embarking on Medicaid managed care. And New Hampshire was one of the last few states to actually go into managed care. So it's brand new. It's very confusing. Just adds to the pile of information that individuals are getting, and they have a lot of choices. So we're there to help. And in fact, we have a new person that's being hired, and her email is enroll@goodwinch.org.
Enroll at goodwinch.org, and she'll be on site and enrolling patients into the program. And if you have questions about whether or not you qualify and will want to enroll, we'll have someone there in the building and out in the community that's helping people navigate this. It has been kind of confusing. There's politics involved, so you get information and misinformation on both sides, and it can be confusing for the person that's in the middle. So Goodwin hopes to play a role in clarifying that for the community. We'll have a dedicated person to do that, and it's coming up soon.
So they can come to you, people listening to this program saying, I don't know about this health thing, pre-existing conditions, everything that they're hearing. They could come to you and kind of get answers and kind of feel a little bit better about things.
Well, the great thing about being a community health center and a federally qualified community health center is we're going to be plugged into the latest information and the latest programs, and this staff person will be able to answer that to the best of our ability. And be able to get people that should be plugged into the program plugged in. Mm-hmm.
But yes, they can come to us.
Yes, they absolutely. Yep.
All right.
Even if they're
we
not
will
patients.
be the resource in the area to help people navigate.
Okay, and in regard to the Affordable Care Act, there's a recent news story that says nearly half of New Hampshire's 26 hospitals will not serve patients who get individual health insurance through Anthem Blue Cross and Blue Shield. Anthem is going off in another direction, I guess, but that's going to affect the hospitals, obviously, and how will it affect you, if at all?
I don't see it as affecting us as much as it affects our patients because they'll have limited choices. Right now, our patients are primarily served by Wentworth Douglas and Frisbee, so my understanding is that they may only have the choice to go to Wentworth Douglas. But for us, we do have a contract with Anthem, so we will be able to accept people that select Anthem as on the exchange, so people can come to Goodwin for primary care.
All right, so that news story doesn't really pertain to too many people in this specific area, but it could. Right. I mean, like you say, day to day, it could change.
Right.
You talked, Janet, earlier about people using the emergency room as their primary source of care. Can people, and not to equate the two, but do patients or people use your community health center in that same way? Can they use it that same way, or do you refer people out?
Right. People need to be a patient in order to see us. We provide primary care. We don't provide emergency care. But I'm really glad that you asked me that question because we have this program that we started with Wentworth Douglas Hospital in January. And we have our outreach worker in the emergency department that's funded by Wentworth Douglas. And anybody that comes in who doesn't have a primary care provider and is coming in for non-urgent care, so could be seen by a primary care practice, is seen or referred to this outreach worker.
Okay.
The outreach worker talks about our services. We are a medical home as by the American National Association for Quality Assurance. We were certified at level 3 a year ago. And so she refers them and actually can schedule patients right from the ER into our system, and then they become one of our patients. Once they become one of our patients, we do have walk-in hours, and they can come in during that time if they have an urgent need, but not emergent need.
Okay.
But it's actually been a great partnership. It has reduced some of those revisits to the emergency department once they establish care with us. So it's best for the patient because they have primary preventative care, there's continuity there, and it also decreases the cost of the healthcare system.
Sure.
I think it's important for people to understand when they're thinking about that. I mean, that's good for Goodwin Community Health. It's good for the patient. It's good for Wentworth Douglas, but it's good for the healthcare system as a whole. What we're really trying to do is shift behavior, and people are misusing and overutilizing the ER, most likely because so many people are uninsured or without a primary care provider. So they're overutilizing the ER, and we're trying to get them into a habit of that you can afford primary care because of the community health center model, and get more people to utilize primary care. And if it's a non-emergency situation, not to use the emergency room. So this has been very successful for us.
It sounds like a very good option. And, I've just realized that we've been through quite a bit of time here. We haven't mentioned a common theme for most people that come on Reporters Files is fundraising events. I mean, things.
I love that topic.
Oh,
Want to talk
give
about
that
it?
one to Lara.
I struck a nerve there.
Yeah.
You must have some events.
We are.
Money is hard to
Yep.
come by, and
We're a
talk about it.
501c3 nonprofit, and we do rely heavily on fundraising. We rely on grants, but we also have a lot of a very strong donor community. Patients that appreciate us, other medical providers in the area that are glad that we're taking care of people that they may not be able to see. People come for us. Our board members are very philanthropic and generous. So we're getting large and small donations from individuals and businesses all around the community. And to those folks, we send out huge appreciation because we rely on it and we appreciate it. And it helps us to bring out the programming that we've been discussing here. But we do have some signature events. The first one that we have coming up actually is November 15th, and we are very pleased to be going to the Rochester Opera House and bringing what I think could probably be fairly stated as the best bluegrass band in the country. The Gibson Brothers are coming to the Rochester Opera House for a benefit concert for Goodwin Community Health. And a little bit about the Gibson Brothers. They were the 2012 International Bluegrass Music Association's Entertainer of the Year.
Ooh.
So they're a big deal. If you follow bluegrass, you know who the Gibsons are. And they just announced the 2013 awards, and they are up for 8 awards, including Entertainer of the Year, Album, and Song of the Year.
Wow.
So you're going to hear some real, authentic Southern bluegrass.
This is major stuff.
It's a big deal, yeah. And we're really proud to be bringing them here. And November 15th, and you can get tickets through the Rochester Opera House box office right now. So they're
And
on
they're-
sale right now.
For only $20.
Yeah,
This is a
it's
deal.
a deal. It's a deal.
That is
It's going to be
such a-
sold out, so get your tickets early.
Nice venue too.
It is. Oh,
Nice.
yeah. We're really happy to be able to support that beautiful art space in our community. So we're happy to go there. After that, we have an event that we've been doing for 16 years, and it's called the Banff Mountain Film Festival.
Oh, yes.
And that's at the Portsmouth Music Hall. And it's every February. We bring this event to the music hall. It is a celebration and film festival surrounding mountain culture. And mountain life and extraordinary adventures around the world. And people document these adventures on film. They submit them to a prestigious international film festival in Banff, and then there's a road show of all the winners. So we get to select the films that we think the Seacoast audience would like best, and it sells out every year. It's a phenomenal event. It's our biggest fundraiser of the year, and that's the Banff Mountain Film Festival, and tickets go on sale for that, usually right after Thanksgiving, so people can give them as holiday gifts.
And that's in February?
That's every February.
Okay, great. Wow, that sounds like 2 great events.
And, well, I have another one.
Let
I
her
do,
rip.
yes. And this is also becoming one of our signature events. And it's the Father's Day 5K at Margaritas. So every Father's Day, there's a great new 5K on the list locally. And it is the Father's Day 5K at Margaritas. For the past couple years, Ross Furniture has generously come forward as our underwriter. And people get out as families. It's a run walk. It's a great certified course, and after you're done, there is a fabulous fiesta, food and fun at Margaritas, which everybody loves.
Yes.
And we invite participants to wear a tie, and this has really caught on in the past couple of years. Everybody you can wear it. You know, if you have a grandfather that is treasured in your family, you'll see the whole family wearing grandpa's ties and running in the race. So you can wear a tie in honor of somebody special, of a special dad in your life, or for fathers everywhere.
Nice.
But it's a great 5K. And we're honored to be putting that out. It's a lot of fun.
Great. Well, some great events coming up in the not too distant future. We've come to that point in the program where it's a couple of minutes left. Where can people reach you? How can people get in touch with you? How can people maybe donate some money to you? They just feel moved this morning to donate some money. How can people do that?
Well, we sure would appreciate that. And there's a donations button right on our website. I think that's the easiest place. It's an online world. And we're at goodwinch.org. So Goodwin, the C and the H are for community health. So goodwinch.org. You can find the donations button. You can learn about our events. You can sign up as a new patient. Our main number is 603-749-2346. And we are at 311 Route 108 in Somersworth in a beautiful new center. So
it is a nice building. I've been by there many times.
Thank you.
It's a very nice building. Well, that we have been talking here today with Janet Atkins, the Executive Director of Goodwin Community Health in Somersworth, and Lara Willard, who's the Director of Marketing and Public Relations there. And we thank you both for coming on. And I'd like to thank you both for just doing something good for people in our community.
Oh, thank you very much for having us, Sam.
All right. And for Reporter's File, I'm Sam Adams.
Reporter's File is a public affairs program of 97.5 WOKQ.